are interested in the program. So I will ask that you hold your questions until I reach sort of a pausing point so that the information can be continuous for groups that are tuning in later. But I think we'll have plenty of time to both get through the material and to ask and answer some of your specific questions. Okay, so I'm going to share my screen. And I'm doing it in this mode so that I can get the presenter tools. Okay, so yeah, welcome to the Worker Benefits Program webinar for 2024. We do 2024 open enrollment in 2023 to prepare for the next year. I'd also invite anybody to put your camera on so that I can be like looking at a face. I always appreciate that throughout. So no pressure, but I appreciate it for anybody who feels comfortable. Um, so yeah, this is our Worker Benefits Program webinar for 2024. My name is Maddie Tatterka. I'm the Worker Benefits Program Manager at the USFWC. So I'm your main contact for worker benefits related matters, whether it's signing up or doing maintenance of current benefits that you're enrolled in, or just fielding questions about the program or benefits as a whole. I am really happy to be able to support our members in this area. I want to say a big thank you to CoBank, who is sponsoring our worker benefits program in 2023. CoBank is a national cooperative bank serving vital industries across rural America. The bank provides loans, leases, export financing, and other financial services to agribusinesses and rural power, water, and communications providers in all 50 states. So we feel really grateful for their support of our program. Yeah. So I like to start all of my worker benefits webinars with the slide to just affirm that we're going to be talking about insurance today. We're going to be talking about a lot of the barriers to accessing healthcare. And there's a lot that, this program cannot fix about the healthcare system on its own. But it is a really important value of this program that healthcare is a human right, and that fundamentally we want to expand access to healthcare for as many people and as many of our members as we can. We have the US FWC Worker Benefits Program to create sort of a safety net, or to sort of make what's available more available, and to lessen the impact of healthcare costs and barriers for our members across the US. Um, and yeah, we just try to keep that sort of at the heart of what we're doing and the way that we interact with our members, and really trying to just navigate the health insurance industry together, and dream of a better world where we all have access to the healthcare that we need, for no cost. So today we're going to be talking about the worker benefits program and the insurance benefits that we make directly available to the members of the USFWC. So the benefits that we're going to be talking about in detail are dental, vision, accident, and disability insurance. These are open to all Federation member classes who meet the plan qualifications. So whether you're a worker co-op or a co-op developer, or a loan fund, or a different kind of organization that serves worker cooperatives, if you're a Federation member and you have employees that meet the qualifications, which we'll talk about later on, your workplace is eligible for these benefits. Trying to keep things as low barrier and accessible as possible to our members. The benefits that we have are available to people with social security numbers or individual tax identification numbers. That's not something that we're tracking. It's just something that's available to all. We're always striving to help make these plans as inclusive to queer and trans folks as possible. Um, and we're always open to feedback and suggestions. Um, Anything that we can do within our capacity and within our ability. We're interested in hearing from our members what your ideas are and how we can improve this program all the time. The other important thing to note is that the Federation and myself and May, we are not insurance brokers. We work very closely with a broker partner called Matthew Tay, who's with Diversified Human Solutions. He and that company are the ones who are creating the relationships with the insurance companies and negotiating the rates and doing some of that technical support. And we do a lot of connecting our members to them when there are things that we as the administrators can't navigate. So that transparency is just important. I also wanted to take a moment to make a note about health insurance. We do not have a group health insurance plan available in the way that we do the other benefits. We have some access to brokers and administrators who can support our members in creating health insurance plans for their co-ops or their workplaces specifically. But because of the expense and the really wide variety of plans available across the US, it's just impossible to create one plan for medical insurance in the way that we can for dental and vision. Um, it's also just important to note that health insurance is really expensive, which I don't think that's a surprise to anybody, but it's just as true for a small worker co-op as it is for anybody else. And it may be the case that your members, depending on your industry and location, may have better access to care and insurance through the Affordable Care Act marketplace or through Medicaid. And so that's just something to keep in mind. I'm happy to talk with anybody more in depth about that. And we also have a workshop from earlier this year that we can share out about sort of how to approach the question of health insurance for your co-op and things to consider and understand about the industry. So first, we're going to dive in to the dental and vision insurance. This is our biggest program through the Worker Benefits Program. We have over 60 of our member organizations are currently enrolled in the dental and vision insurance that we have available, which represents over 600 people across the United States. This is one plan that's available in all 50 states and Puerto Rico. There's a set rate for every person and member who's affiliated with the USFWC. And one of the great pieces about this is that because the plan is organized through the Federation's Member Benefits Trust, the insurance companies bill us and we bill our members, which creates a bridge for members in the event that they're experiencing a cash flow difficulty or something's reorganizing within your organization around like who's the person that does the insurance or the bill paying. And so we're able to keep benefits continuous even if there is a temporary delay in payments, which we know is really important for our members who, we know how worker cooperatives have lots and lots of different things going on and people sharing responsibilities, and we don't want that to be a barrier or an interruption to our members' dental and vision care. So that's one of I think the best parts of this, along with the good rates for strong benefits for dental and vision care. Like I said earlier, For organizations, any member of the USFWC of any membership type can access the dental and vision insurance. We have a requirement that a workplace will pay 50% of workers' monthly premiums for dental and vision insurance. And for the dental insurance, the insurance company has a threshold of 70% of workers enrolling who are not already enrolled in either a partner or a parent's plan. There's no requirement for vision. For individuals, the eligibility is pretty straightforward. Workers have to either be on payroll or be owners of the business. So if you're paid through payments that get recorded on a K-1 as an LLC business owner or something to that effect, that is acceptable. You can still enroll. The only workers who cannot enroll, unfortunately, are contractors whose income is being reported on a 1099. That's just an insurance company rule and an IRS rule that we can't get around. Workers must work an average of 20 plus hours a week. They must have an individual taxpayer ID number or a social security number. And workers can keep dependent children on the plan until the age of 26. We also work to make our plans as inclusive of queer and trans folks as possible. Our plans are open to two-person domestic partnerships of all genders. You don't have to be married. You really just have to be able to prove that you live together or share finances if the insurance company were to ask. But it could, maybe you live with your best friend and, share your expenses or have a platonic partnership there, you can sign them up. It doesn't matter to us. And then we also have a system in place to minimize folks' contact with any legal names or dead names that the insurance company needs to have on file. We've created some systems to minimize the exposure people might have to those names if they're not ones that are used and that people don't want to interact with on a regular basis. Are there any questions about the organizational or individual eligibility before moving forward into costs and other logistics? Okay. So these are the rates this year in 2024 for dental and vision insurance. The dental and vision insurance are staying the same from 2023 through 2024. So if you've seen our rates for this past year, these per person rates are exactly the same as 2023 and will be the same through the end of 2024. So this is the amount that groups pay per person per month for a single worker, for a worker and partner, for a worker and children, or worker plus partner plus children. And that includes as many children as the worker and or partner are the guardians of. Then below we have the per organization per month rates. And so this is a rate that each organization is billed each month. And just to be totally clear, these are not per person. This is just per organization. So if your organization has 8 people enrolled in dental and in vision, that's $36 per month in addition to these per person amounts. And this year, what the main thing that's changed is really that it's now just a really good deal to enroll in dental and vision together. You can sign up as an organization for just dental or just vision, but bundling them together, you're going to pay the additional per person price, but the additional amount that you pay on top is not huge and is definitely smaller than it has been in the past. So the dental insurance plan is run by Delta Dental of Pennsylvania. Delta Dental is a national dental insurance company. They're very common, very well known. And the company name that the plan is under is Delta Dental of Pennsylvania, but it's a nationwide network. And so the plan that's offered uses the PPO Plus Premier network, which is the largest network of Delta Dental's dentists. Um, and the plan covers 100% of routine cleanings and exams, two a year, typically, plus an additional cup cleaning and exam for pregnant people. It covers an x-ray set each year, and for children under 13, it covers a fluoride application each year. So those are covered 100%. And then for more complex procedures, it covers either 80% or 50%, depending on how the procedure is classified through Delta Dental. And there's a like a sheet available with more information about what is under each of these tiers. And another great thing about Delta Dental and this plan is that in addition to having a really extensive network, it also will provide equivalent coverage for any out-of-network dentist. Typically, the way that works is that you would pay for that care up front, and Delta Dental would reimburse you for an out-of-network dentist. Sometimes dentists will arrange it sort of backwards, where they'll still pay the amount and then you get a check and you bring it to your dentist. But it's going to depend on your dental office, so you talk to them. The vision plan is administered by Emeritus, but gives you access to two different vision networks to choose between. There's VSP Vision and iMed, which are sort of like the two big players in vision insurance right now. They are essentially the same type of coverage. The main difference is network. They both are national. They are widely used across eye doctors, and your eye doctor might take both, or they might take one or the other. It's a $10 copay for exams, and then all of them have sort of an allowance / copay for lenses and frames or contacts. Then there's obviously the question of, okay, there are two networks available. How do we choose between the two? And as I said, the main difference between the plans is which eye doctors are in the networks. We have an info sheet about how to find out who's in the networks that are available through our resource library. And at open enrollment time, which is now, your organization can choose if they want to offer one network or both networks. If you offer both networks, then each worker chooses which works best for them. And that really could be decided as simply as calling up your eye doctor and saying, hey, I have the choice of iMed or VSP, which one works for your office? And then going with that one. Does anyone have any questions about the networks or plans before moving on to how to enroll? Sip some water. Thanks so much for being here, TJ. Well, yeah, you'll get the recording. Okay. So right now is open enrollment time, and open enrollment is runs until December 7th. And groups who are enrolling during open enrollment time are enrolling for plans that begin on January 1st, 2024. So it's the time when anyone can enroll across any group. Any group can enroll. So as part of the enrollment process, organizations have responsibilities and the Federation has responsibilities. So each organization during open enrollment time is expected to inform workers of their eligibility. So if your organization decides to enroll, the first step would be to let everybody at your organization who's eligible know. You can distribute the info sheets that we have. Great to have a meeting. You could even distribute this sort of webinar so that people understand what benefits are available to them. And then once people know what's available and have decided if they want to sign up, if they want to sign up any dependents or anything like that, or if they have questions, then the organization needs to fill out a roster, which will supply. The roster is a list of everybody who's going to enroll. And then in addition to the roster, each person has to fill out an enrollment form. After an open enrollment, the organization is responsible for informing new workers of their eligibility and supporting members with troubleshooting if there is something that happens with billing or if somebody can't locate their insurance card. Each organization is expected to have sort of a point person who can relay those sorts of questions to the benefits team or who can help people troubleshoot just with the information that we give your groups. It's also the organization's responsibility to inform departing members about COBRA, which is a program where people can continue their benefits by paying for them out of pocket. On the Federation side, it's our responsibility to make the information about the plans available. It's our responsibility to answer questions and refer to the broker or ask the broker questions that we pass along, and also to communicate about any missing information that comes in or that doesn't come in when people are submitting the forms. So one of the reasons why we have each group submit a roster and each person submit a form is so that we can check them against each other and make sure that we've received all the information that we expect to receive. After open enrollment, so throughout the year, it's our responsibility to process changes to enrollment in a timely manner, distribute our billing invoices monthly and make sure they are correct, respond to requests, and answer any questions in a timely manner. Usually we get back to folks within a week, if not a couple of days, if not a couple of hours. We try to really stay on top of that and get back to people as fast as possible. And there you can see this little Canva graphic that I found that looks like me doing my job each day. So for billing, like I said earlier, the way that billing works for the dental and vision insurance is that the insurance companies send the Federation, our member benefits trust, which is just the entity that holds the money, sends us a bill for every person who's in the worker benefits program. So we get a bill for 600 plus people. And then we look at the list of everybody who is in that bill and we parse them out to each enrolled organization. So we then send a bill to each member that includes a list of everybody enrolled, affiliated with your organization, their individual premium for each month plus that administrative fee. That comes as an invoice from QuickBooks, line item for dental total, line item for vision total, line item for admin fee with a roster attached. So you have the opportunity every month to make sure that your roster is correct. And yeah, just to make sure everything is looking correct with your enrollment, what you expect it to be. You can set up auto payments if you want. You can pay manually each month. We try to stay really open and flexible so that each member can do what works best for them, because we know our members do things all different ways to fit all different kinds of needs. So we're going to go step by step again through just the enrollment process, reviewing. The first step is to review the benefits information with your fellow workers. Makes sense to hold a meeting to share the info sheets. This is what one of them looks like. You can send any questions to us at benefits@usworker.coop. You can also sign up for a meeting with me or with May to go in more detail if that is what you need for your co-op. And then once you're ready to enroll, email us. We'll send you a long email with a lot of instructions, but it's not that hard. You'll determine who wants to enroll in benefits, keeping that number of 70% in mind for eligible workers who don't already have coverage. So if someone says, no, I'm good, I'm on my partner's plan, you don't have to count them towards that total. And there's no minimum coverage for vision. You're going to receive a roster, make a copy of a roster that looks like this, include everybody's name, the subscriber. So if someone is a dependent, it would be the dependent name and then the worker they're attached to, plus the plan that they're enrolling in, their email. You'll receive instructions on how to fill this out. I'm just more including this so you know what it looks like when you get there. And then again, every individual enrolling, every worker enrolling needs to fill out an open enrollment form, which looks a lot like this, with name, social or ITIN, address, date of birth, email, legal gender marker, so whatever is on your ID, the associated co-op, that's really important. Making sure also that if your organization has if your employment is technically with a different organization than the one you might say you work for, to try and make sure that that associated co-op or business is the one that your employment is tied to. And then if you're enrolling a spouse or a partner or children, clicking on these boxes will open up the identifying information fields for them. An important piece about this is that we do not store the private information that is identified on this form. It goes directly to our broker, who sends it directly to the insurance company. So we don't store social security numbers, we don't store addresses. The only things we keep on file are names and dates of birth so that we make sure we have the right person in the right spot. So benefits begin on January 1, 2024. For all the people, for everything that comes in before September 7th, that's when benefits begin. They're effective immediately. So even if you haven't received any information from your organization yet, you're still eligible for, you're still enrolled in the insurance. It starts on January 1st. It is important to note that as of this year, these insurers do not send paper insurance cards. You'll receive a packet called the plan document that includes detailed information of how to get your digital card online, and also how to access benefits without an insurance card at all. All you need is the insurance company name and your social or ITIN, and that should be sufficient for your dentist or your eye doctor to pull up your information. Once you're enrolled, you'll receive a lot more information about how to access your benefits. We're not going to go deep into that right now. Just rest assured there will be a lot of resources about that available. All right, now we have a moment for questions, and then we're going to dive into accident and disability insurance. Questions also welcome from Federation staff if you have them. Okay. Yeah, Ellie, go for it.
I had a question, Maddie, about what happens. Let's say someone emails you with a concern or an idea, for member benefits. Um, what happens after that? If you can just share like the process, like once that email is received.
Yeah, that's a great question. I mean, so just sort of like a suggestion for the program as a whole, is that, yeah, so um, every email that comes into benefits at usworker.coop is read by me. Um, and feedback that we get, I bring back to our membership team for sure. And depending on what it is, it could be a suggestion or just like a statement of need for a certain kind of benefit, which might go sort of into a document of for planning and like long-term tracking what our members are interested in. Um, but if it's something like here's actually a really good example. We used to call the worker partner child plan the family plan. And some people were confused because families are so much more than um like your partner and your kids, and so people were curious if they could enroll a parent that they lived with or a sibling. Um and we realized that, oh, calling that the family plan was really not descriptive of what it was. So I just went into our database and changed it to be worker partner children instead of family. And stuff like that, it's like straightforward for us to change. Like, we're just going to change it because it makes sense. Yeah. Cool. Okay, I'm going to go on to accident and disability insurance now. So, what are accident and disability insurance? The disability insurance that we have available is short-term disability insurance, which partly replaces income in the event that someone can't work because of an injury, an illness, or pregnancy and childbirth. Accident insurance is a different kind of insurance that just offers flat payments to supplement medical costs if you are in some sort of accident and need emergent medical care. Accident and disability insurance, like the dental and vision, are available in every state. And for most states, they're available at the rates that are set in Pennsylvania, which is really important for our members to note because that actually results in a lot of savings for workers in certain states, especially California. Um, the rates are just set lower in Pennsylvania than they are in other states. These are voluntary benefits, which means that workers can simply opt in, and it's the worker's responsibility typically to pay for them themselves. Payment is arranged directly with our broker partner, Diversified Human Solutions, or their sort of associate business fellow travelers. There is an option for workplaces to pay for disability insurance in some circumstances, but that does mean the benefits are taxable, um, which is important to know because it's already a partial income replacement. And the other nice thing about these benefits is that they are portable, which means workers can keep them if they move on to other jobs. So I like to think about packing these benefits up in a suitcase and like taking them to your next workplace. The short-term disability insurance, the plan is provided by a company called Colonial Life, and it provides up to 6 months of partial income replacement in the event that someone can't work because of injury or illness that originated outside of the workplace or pregnancy and childbirth. There's an option to add coverage for injury or illness that happens because of something on the job. But the reason why that's not the default is that those are typically expected to be covered by workers' comp. It's also important to note that disability insurance can exclude coverage for pre-existing conditions. So that's one thing to think about to sort of lock in disability insurance, even if you don't presently like have any illnesses or don't expect a need for it. You know, nobody expects necessarily to become sick or injured, and so it can be really valuable to just get a plan like this in place. So if that situation should arise down the line for you, you are already protected for that period of time. Another important thing to note about this is that pregnancy and childbirth is the very specific qualification to use this benefit. It's not available to be used if you become a parent. Either your partner has a child through pregnancy or childbirth, or you adopt a child. This benefit just doesn't cover that. It's about like the bodily experience of being pregnant or giving birth and giving birth. Um, yeah. Disability insurance, the calculation for how much it costs is a little bit complicated because it is essentially insuring your income. So it's directly in proportion to what your income is. Um, Basically, the equation is that you take 60% of what you earn before taxes, divide that by 100, and multiply it by the cost per 100 listed here. So that would be January 1st, 2024. We have the example of Tom, who works 28 hours a week and earns $15 an hour. So on average, he earns about $1,700 a month before taxes at this job. So 60% of that income is $1,000. So Tom has to pay $2.14 per month per $100 within that $1,000. So we divide 1,000 by 100 and multiply it by $2.14, which means that to ensure that $1,000 a month, Tom has to pay $21.40 a month for disability benefits. So that's just an example because the math is really clean. There is a calculator available from our broker to better understand how much you might be paying specifically for your salary or your wages. Accident insurance works differently than disability insurance and is a lot simpler. Um, because what accident insurance is you pay this amount each month, and then in the event that you are in some sort of accident, they will basically like look at the list of things that occurred and pay you like flat amounts in relation to those things. There's actually a information sheet about it. There's a lot of information sheets with insurance, and it has a full list of like this amount of money if you traveled in an ambulance. You get this amount of money if you got an x-ray. You get this amount of money if you break your pinky. You get this amount of money if you break your thumb. It's like a very bizarre and morbid look into insurance, because what insurance is always doing is assigning a like dollar value to things that are happening to you as a person. Um, but that's how accident insurance works, is that it will pay you out this amount of money for you to do basically whatever you need with. It's not in place of health insurance. It's not going to um, cover like the full amount that things cost, but it's basically designed to help um, with out-of-pocket costs that you don't anticipate, or the basically what you're expected to pay through your health insurance. So there's a lot of resources available through our resource library, and that we'll send out to understand more about sort of what exactly accident insurance offers. Um, but it's not a terrible thing to have if you have like an insurance plan with a high deductible or high copays. Um, yeah, I mean it's another thing that, you know, none of us can anticipate when something like this might happen. So it could be a useful thing for you. It's a decision for each person to make on an individual level. So who can sign up for disability or accident insurance? Again, this is open to any members of the Federation. The fee to access these benefits is just $75 per organization. And individuals who enroll have to work an average of at least 20 hours per week. This will be verified by the disability insurance company in the event that you make a claim or you um, submit to use the insurance. And the disability insurance company will be very particular about making sure that documentation exists properly, um, so that they, yeah, because insurance companies like documentation for things like this. Billing for this works differently than the dental and vision. The bill goes from fellow travelers, which is affiliated with our broker, out to each individual. Um, as I said before, organizations can opt to pay for these benefits, but it will result in the benefits being subject to income taxes, so it would lower the amount of the benefit. Uh, and with these plans, timely payment is very important. You can set up auto pay really easily, but lack of payment will result in ending the benefit. Um, so that's just something to keep in account. Getting started with accident and disability insurance, again, is just a matter of determining if your workplace wants to offer it. There's no minimum number of people who can enroll. So you know, if someone in your workplace really wants this benefit, it can be a great thing to just pay the $75 for access, and that person can then enroll, and anybody else who's interested can as well. You notify the benefits at usworker.coop, so that's contacting me in May. And we'll send out the enrollment form and all the materials. And then follow up for payment happens through fellow travelers. Any questions on accident and disability insurance? Hey, go for it.
Yes. So it's about the payments, and I just wanted to clarify that, or yeah, I wanted to ask you to clarify because for the payments for the disability insurance and vision and dental, I know they're different, but for confirmation, if members do not pay for disability, then they won't have access to their service. Whereas if they have dental insurance, since it's a wholesome and we provide a whole different wholesome approach to the payment, it doesn't matter if they don't pay it on time because the membership bases are from correct. So there's no like they're not as strict in comparison to liability and accident, right?
Yeah, I would say it does matter if people pay their dental on time because, part of why we can extend flexibility to some groups is because of relying on groups to pay on time when they are able to. Um, but we are able to be more lenient with the dental and vision payments um, because of the way the program is designed, which the accident and disability doesn't have that built in. We do with the dental and vision, it is important to note that we do require like communication if there is going to be a delay in payment. If groups know that they aren't going to be able to make the payment on time, we can accommodate that almost always. If groups are just not paying with no communication, then we do have a policy of late fees. And if the payment is not made a number of months in a row with no communication, then we do have to cancel benefits. But that's all laid out very clearly in our participation agreement, which each group has to sign before benefits begin, and is also explained in the invoices that are sent out each month. Ellie has a question. Just to confirm, someone can continue both of these benefits even if that person transitions from their current workplace. Yes, for accident and disability insurance, that is the case. It's not the case indefinitely for dental and vision, though workers can elect to enroll in COBRA coverage, which in which they could continue the benefits by paying out of pocket for, I think, up to 18 months. It's a good question. Okay, and then we have these key links that will be distributed with the recordings, which is the interest form and Calendly scheduler if you want to make a meeting to discuss more. We also have the worker benefits website, which is just has all the information about our plans available from it. We have a knowledge base, which is an FAQ that includes some frequently asked questions. Our resources that are available in English. This is a preview of that website. It's just all the folders of the different handouts and info sheets that I've mentioned today, which you can also reach directly through our public box files. Yeah, all of this is also available in Spanish. And next week, we will have this webinar presented by Kate in Spanish for bilingual access to our worker benefits program. And yeah, so that's our presentation. Again, I'm Maddie, the Worker Benefits Program Manager, and we also have May on this call, Worker Benefits and Membership Coordinator. Other key members of our Worker Benefits Program team, we have Kate Barut, Membership Manager, Tamina Brohi, Membership Director, and Matthew Tay, our broker, who is with Diversified Human Solutions / Fellow Travelers. You can always reach out to us at benefits@usworker.coop or give us a call. You can schedule a Calendly session with us and check out our website. And then next week we have the same webinar available, presented in Spanish, same time next week, I think. And then in November, we're going to have open enrollment office hours for any like lingering questions, or whatever it is that folks are needing at that time. And finally, thanks again to CoBank for sponsoring this webinar. And that's the end. Henny, I think you're the only person who is not on Federation staff on this call right now. So if you have any like particular questions you want to ask, it's a great time. Also, no pressure. We can just wrap it up. And I think we can stop recording now.